If you're turning 65 in the next 7 months or so, you probably heard and felt that Medicare is not a one size fits all thing that is very simple to understand. And you probably found that out the hard way because nobody warns you that Medicare is really confusing and can be convoluted if you're not careful. And here's the part that I see that most people get anxious about. And you have much right to actually be anxious about that because you can hit a lifelong penalty if you aren't careful. And also, the decisions that you make with Medicare can be permanent or feel like that going forward. If you get the timing wrong, again, you can be faced with a lifelong penalty that continues to creep up every year. So let me make this simple. My name is Joel. I'm a licensed Medicare educator, agent, if you will, and I'm also a software engineer. Weird combination, again, I know. But what that means is I'm really wired to understand complicated stuff and make it sound and feel simple. So if you will, give me the next few minutes and I'll walk you through all of the alphabet soup that is Medicare. And also I'll give you the 5 mistakes that I've seen most people make, most good people make, so that you don't have to. So, like I said, the alphabet is very much available inside of Medicare. So I want to do this fast but gentle. So here we go. So you have Medicare that has its 4 parts, and specifically the first 2 are called original Medicare, parts A and B. Part A is hospital coverage. Most people get this premium free because you paid into it the entire time that you were working. Part B is your doctors and outpatient care, and that usually comes with a premium that has gone up in the last year. And it also tends to go up pretty much every year with inflation. Now again, A and B together, that's called original Medicare. Got that? Cool. Part D then is your prescription drugs, and Part C is what is known as Medicare-Advantage, and it completes and covers or puts an umbrella pretty much over everything. But it is a different way to get everything bundled together. Now that we have all of that taken care of, the biggest fork in the road for most people is that once you have parts A and B, you generally then need to go in one of 2 directions. You either then add a Medicare supplement, which is also known as a Medigap plan, that then would cover what original Medicare would not. Or you go with a Medicare Advantage plan that then bundles things all together. Now, I want you to keep in mind that these 2 roads are treated very differently and act very differently because they will have different rules around your doctor, different rules around how you can travel and get health care as well. Now, I'm not going to obviously tell you the one that's best for you because that is a case-by-case basis for you based on your lifestyle, your situation, and how you want to continue your life going forward, and how your healthcare plans fit all into that. But I did promise you 5 mistakes that most people do make, and I want you to not have to make those. So, number 1, missing your enrollment window is pretty huge. So, if you didn't know, you have a 7-month window around your 65th, 3 months before your actual birthday and 3 months after. Now, if you miss this without a qualifying coverage event or having qualifying coverage, you can be hit with a penalty that is lifelong. So for all that is good, please don't miss this one. Mark the calendar if you haven't already. Mistake number 2, assuming it just happens automatically. That's not true. Now, some people do automatically enroll, and that is only if you, for example, are taking or receiving Social Security. But majority of people are not doing that at the moment, and they might assume that the Medicare thing just kind of happens. And that window that we talked about earlier quietly closes, and that penalty creeps up really fast. Number 3, picking the path that you decide you want to go on, Medicare Advantage or Medigap, whatever, before you actually check if your doctors are available and if your medication is going to be affordable as well. Now, this is the thing that I see that causes most regret in most people. So, before you actually make a decision, make a list. List out your doctor, list out all the medications that you have or potentially will have, and Also, list out all of the things that you want to do in your life. Do you want to travel more? Are you deciding that you want to take up some more hobbies or whatever? Make a list before you make the decision, because the right choice here with someone with no medication and a doctor anywhere is completely different from someone that's managing a chronic condition with a specific specialist that they love. Mistake number 4, looking only at your monthly premium. Now, I get it. That's the thing that's in your face all the time. And it's easy to just look at that and think everything is okay at face value. And that number is very easy to compare, especially against your budget and all that kind of stuff. But from what I see, the premium isn't what hurts most people. It's the surprise bill from the hospital stay that nobody ever plans for. The real question isn't what's the monthly cost. It's really, what is this going to cost me in a bad year? As a rule of thumb, and this is something that I tell all of my clients, look at the worst possible scenario and think backward. Then there's number 5, and this one's pretty personal for me. Going it alone and trusting anyone that's shouting the loudest from whatever mountaintop they're shouting from. And that particularly means, for at least for me, the Joe Namath commercials and all that kind of stuff. Those are notoriously bad. Well, not bad information specifically, but it can be misleading for a large majority of people because it isn't tailored to you. So, for the love of everything that is good, you don't have to use me, though if you would like and you enjoy spending time with me, I'd love to have you. But find someone that you actually trust that is unbiased and will give you real information that you can actually go and do something with, so that when something happens, they're in your corner and you don't have to worry about what's going to happen with my Medicare and all the things that happen around bills and stuff like that. You don't need that headache. Find someone that you can actually ask questions from, get unbiased information, then you can make some detailed actions with that information. Now, here's the thing that I've learned over the last few years that I have been doing this. The people that usually have something go wrong in their Medicare aren't careless. They were probably just rushed and unsure about the decision that they were actually making without having the proper information laid out for them with all of the different things that were available. So that's exactly why I do a free Medicare 101 class that's completely online that you can take from your couch. It's plain English, no pressure, a whole lot of fun most of the time. And if you like, you can just listen, or if you have specific questions, feel free to bring those as well. I walk through everything that I talked through inside of this video. If you have specific questions that you really need to get answered, feel free to bring every single one of those. If you want, save yourself a seat. The link is in the pinned comment and inside of the description below. But if you're not ready for that yet, totally fine. At least grab the free checklist that I have as well for you. That is also linked inside the description. That will tell you the 7 things that you need to look out for in terms of scammers and scams that are out there right now that are prevalent in the wild. But hopefully this has helped and actually has helped you make better decisions with your Medicare if you are making that decision right now. And until next time, until next video, thanks for being here, and I'll see you in the next video.